So hip arthroscopy, also known as keyhole surgery to the hip, is a way of addressing disease or pathology within the hip using very few and minimal incisions in and around the hip. It's usually considered when patients have tried non-surgical treatments such as physiotherapy, injections, or exercise modification or avoidance. The type of conditions we often encounter will be labral tears, resulting in something called femoral acetabulate impingement or just hip impingement, or dealing with bony bumps around the hip, such as cam lesions or pincer lesions around the hip. Yeah, people generally recover very well from hip arthroscopy and reasonably quickly. Often it mandates 1 to 2 weeks on crutches. And if people are doing office type of work, it may mean that they take 1 to 2 weeks off work. Thereafter, people are able usually to return to walking without crutches and walking increasing periods of time. But physiotherapy is really important. And we generally get people seeing the physio from within the first week. And physio can often be on a per week or per 2 weekly basis and can last anywhere between 2 and 3 months. And the physiotherapy will guide the patient. It's very much a bespoke treatment. And so there's not a magic formula for everybody. But the vast majority of patients, I would expect to be getting back to sports within and around 3 months with a significant improvement in pain and in function. Within 6 months, if keyhole surgery goes successfully, people are doing anything they want without restriction. So keyhole or hip arthroscopy surgery is generally well tolerated with a low and acceptable complication rate. The risks that could occur would include infection, bleeding, nerve injury that could cause weakness or numbness, damage around the skin, or even femoral neck fracture or breakage of instruments. Keyhole hip surgery is very successful in a well-selected patient, and we would expect anywhere between 90 to 95% significant improvement in the vast majority of patients. The reasons why keyhole surgery may not work can be to do with the existence of arthritis, which is not recognized before surgery, but is only evident at the time. And this can have an inverse or negative correlation with the outcome of surgery. The other thing that's important to ensure optimal success is compliance with physiotherapy, because what we do know is that keyhole surgery and physiotherapy combined does better than surgery alone.